So she placed it horizontally across the lower sacrum, and she's simply doing repeat forward bends through a small range of motion. And this is what corrected the sacral torsion. It was a hands-off treatment that made her independent in one visit. So she knows how to manage that and utilize prevention, and should it recur, she knows how to do self-treatment. Okay? So she did present with the side bending pattern of the coccyx, but correcting the sacrum resolved the side bending pattern of her coccyx. What I then did, let's have you lie on your stomach, was I worked on the soft tissues around the coccyx. So I located, of course, the coccyx, which is tender to touch, and I contacted the soft tissues on the right side of it, and just worked with compression to get them to relax, and did the same thing on the connective tissues on the left side of the coccyx. Then I took a dowel that we make. We sell them on the Hesch Institute website, and they're very inexpensive. And we place it against the coccyx, okay? And because the coccyx was pushed posteriorly, we want to push it anteriorly. Now we also want to get a little bit of distraction to that joint. And so we accomplish that by having her place the dowel here, bend down a little bit and lean against the wall. And what she's going to do is gently lift her pelvis up against this dowel, and that will create inferior traction and anterior glide. And it seems that correcting the torsion was, of course, part of improving the coccyx pain, but it's my opinion that the dowel was critical in helping her restore positioning of the coccyx. And am I correct that you progressively noted that the coccyx feels more forward?
Yes, yes.
And do you agree that treating the coccyx was very important?
Yes.
Okay, so if you would demonstrate what you do against the wall. So she's placing the dowel straight up and down, and she bends her knees a little bit, and then she just progressively lifts the pelvis up into the wall.
Give it just a little bit of traction.
Yeah. So she's getting traction, but she's leaning against the dowel, so the dowel is effectively pushing the coccyx slightly downward and forward. And how long do you do this?
About a minute or two, as
Perfect.
long as I can. My knees get wobbly at some point. But.
Sure, because it's a non-position.
Mm-hmm.
Yeah. Very good. Mm-hmm. So I'm really pleased with the results, and I'm pleased to be able to film how we treated a coccyx that was extended or backward bent in response to birth trauma. So I hope this is helpful and informative, and I hope that with the guidance of your healthcare practitioner, if you have this pattern, I hope that you can get successful treatment. Or if you are ever in the Denver area, we are in Aurora, Colorado. Thank you very much.